Welcome back to Therapy Thursday. A few weeks ago, we introduced an exercise for early stage ankle rehab after an acute sprain. Today, we're going to show you a quick progression of 3 exercises that we like to use from mid to late rehab, or when people come to us saying, I feel like my ankle is weak and I want to make it stronger. This is a progression called the star excursion balance exercise and how we use it as a rehabilitative tool as opposed to an assessment tool. Exercise number 1 is called the Y balance test or Y balance screen. This one's gained a lot of popularity because it's been incorporated in the functional movement screen series. With this exercise, let's assume that my left ankle is injured. I'm going to essentially have my hands on my hips and I'm going to push as far forward as I can. Now there's a tool out there where you're actually pushing a block. We make it simple and just put tape down on the floor. So I'm going to reach forward, back into the outside, and back towards the inside. The good news is if my left ankle is injured, I can use my right ankle as a comparison. We want to see them reasonably close together. So that's our first phase exercise. Exercise number 2 is the full star excursion balance screen. You're going to see that there's multiple motions now, almost like a clock face. In fact, sometimes when we send people home, we just say picture a clock face on the ground. We have the individual touch to 12 and back, to about 1:30 and back, 3 o'clock and back, 4:30, all the way around, tapping the edge of each of one of these. This is going to create more stability demands from multiple directions, which is good for the rehabilitation of an ankle during the mid phase. Exercise number 3 is going to be the same as exercise 2, but now we're going to increase the demands. There's going to be a jump, which is going to be a power demand, as well as a land, forcing the ankle to land off of a jump in multiple directions. So same exercise, I'm going to come forward and tap. Just as I'm coming back, I'm going to jump, stick the landing, then go out to 1:30, jump and stick the landing, to 3, jump and stick the landing, all the way around again. So that's a really easy 3-stage progression of one exercise that you can utilize to create better control of the movement from multiple directions. So it involves power in terms of creating the jump from a series of directions, as well as the ability to distribute load on the landing portion of each jump. Now, one caveat, people are probably going to write in and say, well, that's not good enough. You know, I'm a sprinter, a soccer player. I need lateral work and side-to-side movement and hurdles. You absolutely need that stuff too. You also need some strengthening component and perhaps some manual work as well. This is just a simple progression of an exercise we like to use that's portable, that people can take it home without any equipment, and therefore we like to use it with any form of ankle sprain in terms of rehabilitation. See you next week on Therapy Thursday.